Hi, welcome ladies. Welcome to Western Connecticut Nursing Simulation Lab. My name is Professor Hull. I am the simulation coordinator for the nursing program. I'm really excited to be taking you on a virtual tour of our simulation lab. We're going to be entering the ICU simulation lab just to get an idea of what it looks like in our simulation lab. So in the nursing program here at Westconn, we really pride ourselves on getting the students as much hands-on experience as we can. So when they do go to the clinical setting in the hospital or other places out in the community, they feel comfortable dealing with people. We are in an ICU lab now. So the students, when they get to this point, they're really familiar with simulation and they're very comfortable with simulation. So they delve right in. You can see we have all this technology here. We have a code cart, an EKG machine. The mannequin lives and breathes and does everything that a human can do. He bleeds, he can cry, he blinks, he's got heart sounds, he's got lung sounds. The students at this point in time really need to know how to do a full physical assessment. We can deliver medication, so this is a medication cart. So we really pride ourselves on making sure that when the students graduate from this program and become practicing RNs, they are really focused on patient safety. So this is what's called a med administration cart. They learn how to deliver medications properly, appropriately, and safely. They learn how to take good vital signs and do full physical assessments. So this mannequin breathes, he's got heart sounds, lung sounds. You can do anything that you would be able to do on a human. So the scenarios that we set up in the sim lab are all different types of health scenarios. And by the time the students graduate from here and move up onto the clinical setting, so for example, they go to whatever hospital they're assigned to for their clinical rotation, they will go up and feel a lot more comfortable interacting with patients after they've had these experiences. Ladies, please join me in Mother-Baby Land. So as you can see, mom has just delivered a very healthy baby. This is Sim Mom. So when the students are juniors and seniors, they do a rotation in pediatrics and obstetrics. And this is a mother mannequin who can deliver both healthy babies and also have complicated deliveries. This is one of our most used simulations. Mom delivers babies anywhere between 5 to 10 times a week. The students really love this because we can get actual deliveries, whereas if you go to the hospital for a clinical, you may not see a delivery on your rotation. So we can recreate different scenarios where mom is delivering healthy babies and the students learn what that looks like, as well as more complicated scenarios where the students learn how to take care of a mom who could potentially be in distress. We also have a simulation baby over here. This is simulation baby. This mannequin does everything that a baby could do. So this baby has heart sounds, lung sounds, breath sounds. We can make the baby either be a very perfectly healthy baby, or we can have the baby have some complications. So the nursing students really learn how to take care of a newborn who could potentially have some complications. And over here is our little nursery where the students learn how to take the baby from mom immediately after delivery and do the things that are necessary from a nursing perspective with a newborn. We're going to go in and see some sick children. I want to introduce you to Timmy Green. Timmy Green is one of our pediatric patients. This is a great rotation for the students to be introduced to the health of young folks, pediatric patients, anywhere from the ages of 1 year old up to 18 years old. Timmy Green can do things as have health issues as simple as asthma exacerbation, and he can have things as complicated as trauma. Our faculty members focus highly on med administration. This is our med cart. So again, we focus highly on safety, administering patients' medications safely. The nice thing about all these simulations is they're really small groups. So the students and the faculty work together in small groups. So it's really one-on-one contact with the instructor and the patient. In the event that we can't get them the experience in the clinical setting in the hospital or out in the community, we can recreate all those simulations and scenarios in the sim lab. As you can see, what happens, the way simulation works is we will give them a scenario, we will give them a pre-briefing. So we'll tell them, Timmy Green comes into the hospital short of breath. His mom is at the bedside, and then the students have to walk through the scenario. The instructors, and this is similar in all of the labs, will be behind the glass. This is what we call the control room. So the control room is where we run Timmy. So we run all his vital signs, and we actually are Timmy, so we speak through Timmy. But the students really have to delve into the scenario, and you would be surprised at how they suspend disbelief and they really get into the scenario. At this point in time, they're either juniors or seniors. So they're very comfortable with simulation, and it's great to see them interacting in a setting where they can make mistakes. And we allow them to make mistakes. We encourage them to ask questions so that when they get out into the field, they're really prepared to take care of scenarios that in the real world. They make their mistakes here so that they don't make their mistakes in the real world. Now we're going to be entering one of the nursing labs. Another thing that we take great pride in at Westconn is the small classroom sizes and the student to teacher ratio. In this lab in particular, the nursing faculty can use the whiteboards and the smartboards to do the didactic portion. They can draw on the smartboards. They can use the computers to demonstrate any of the didactic learning. After they've done the didactic learning, we can come down and set up stations, and as you can see, we have small stations, small groups of folks here, so the class sizes are small. The nurse to student ratio is great. You get a lot of one-on-one attention. These stations are set up for IM, IV injections, so the students will be doing something, will be learning how to give patients injections safely. The computers at the side here, so if they need to look something up or research something, we give them the tools to develop skills to learn how to look things up appropriately, learning to use evidence-based nursing on their computers. We also, as you can see in the back here, these are all different stations that we can set up. We go as simple as introducing yourself to a patient all the way up to learning how to take care of an eye. I'd like to introduce you ladies to Harvey. Harvey is our cardiopulmonary mannequin. This is where the students learn how to assess heart sounds and lung sounds. They also learn how to associate heart and lung sounds with blood pressure and pulses. He's a great tool to do different assessments. This classroom is specifically designed to do the didactic portion on the smartboard. So the faculty will present the information up on the board, and then the students can get a hands-on experience. This room comes equipped with another lab in the back. So after the didactic portion, the students can come back here. This room can be set up in any number of ways. Most of the time we use it as a primary care setting. The students learn how to introduce themselves to the patients and do physical examinations in this room. As you can see on the wall, they learn how to do inspections and assessments on the patients. We have our otoscopes and our ophthalmoscopes, blood pressures. This is a great room for them to grow accustomed to introducing themselves to the patients and getting comfortable in their first couple of years of nursing. Well, ladies, thank you for letting me give you a tour of the Nursing Simulation Lab. We really look forward to having you here on campus. The nursing program provides a great deal of support to our student athletes, and we'd really love to see you come out. I look forward to seeing you in the future, and thanks once again. Good luck.